Joining us now is Dwayne Baxa. He is the Associate Professor, Oakland University William Beaumont School of Medicine. Dwayne, thank you very much for joining us here on the MegaCast.
Thank you. Good morning. Thanks for the opportunity.
Oh, good to have you with us. So I apologize. My script for the show today does not have a doctor in front of it. Are you Dr. Baxa?
I am a PhD, yes.
Okay, that's what I thought.
Not a physician, but a PhD.
Right. So I don't know, do I call you Dr. Baxa? Do I call you Professor Baxa? Do I call you Dwayne? What do we call you?
Dwayne is fine. I answered anything. So
all right, very good. So we've really appreciated the contact that we've had with a lot of the professors at Oakland University. Let's talk COVID-19 from the medical side, if you will. What are your thoughts as to where Michigan is right now? And I don't know if you saw the governor's press conference yesterday, but we have not all loved the things that she has done. I mean, she said, well, you can power boat, but you can't sail. You can golf, but you can't take a cart. And I can go on and on. But at the same time, Michigan is in about the best spot of any state in the country. Your thoughts?
Well, I agree. I think we are in one of the best spaces for the country. Obviously, these things have been a major inconvenience to us, but they are essential, right? Because we deal with a population that's susceptible, and we are concerned that those individuals are going to become infected and join the infected population. And right now, the concept of herd immunity is that the individuals would become ill or be vaccinated, and we just don't have the numbers of those individuals that have survived the infection to basically say that we can return to normal in terms of our associations with each other. So I think, though, that we've had these inconveniences, I do think that they have made a major impact in preventing the spread and managing those people that are infected so that they can get the best care from our hospital systems.
Well, Professor Baxa, you should know you worked in the Division of Infectious Diseases at Henry Ford Hospital in Detroit as a technical director of the Infectious Disease Research Laboratory. COVID-19 is still out there, right?
Oh, absolutely, yeah.
And what do you make of the states that have been having problems, that we are seeing new peaks? What can you glean from that?
Well, we know that this is a possibility as we start to release some of the restrictions that we've seen. The question is whether or not these communities are doing this in an all-out procedure or if they're doing it phased. And actually, the way that Michigan's approaching this, I think, is wise in terms of phasing things in over time, where we can get information as well as continue to do testing and contact tracing, find out which individuals are infected and those people that they associate with. In combination with those things, we will be able to determine, whether or not certain interventions are more effective than others, and whether or not there are certain things that we need to maybe revisit in terms of future spread.
Well, Dwayne, obviously, we'd all be better if we just stayed at home and locked ourselves in our homes. But, it's just not practical economically. I think everyone would agree that we just can't go back to isolating ourselves entirely. But you look at the things that we've done. First of all, hospitals are in much better shape. We know how to treat. We've learned how to treat. We have hospital beds now. And even if we were to have another peak, we have the PPE, we have the ventilators, we have the other things to be able to better treat people and deal with another peak if we get it. But I think maybe one of the biggest things we've learned with all that is, as individuals, we definitely know the things we can do to make this better, not only for ourselves, but for the community, starting with wearing masks.
Certainly. And washing hands. That's one of the basic things that you can do for any infection, is to prevent the spread, is by washing your hands appropriately. So I think these things, we've seen the governor touted one model in particular that showed that Michigan has done an excellent job of reducing the number of infections, and that those limits on mobility have had an impact. The thing is that there are other interventions as well, and in combination, these things are making a great impact. So as we reduce restrictions or release restrictions, we need to continue still wearing masks, doing social distancing, washing hands, and so forth, at least for the foreseeable future, until we do have some vaccination opportunities in the future. The thing is that we could quite easily, if we give up and say we're tired of doing these things, we could quite easily go back and have these spikes, as you mentioned, these peaks. And even though we're in a good situation to handle them right now, we could also easily overwhelm the hospital systems because there are only so many beds available for those with severe infection.
Dwayne Baxa, he is the Associate Professor, Oakland University Beaumont School of Medicine, and has got a very impressive infectious disease resume. We appreciate you joining us. So, hey, what do you think? I mean, do you think that if we start to see numbers increase here in Michigan, that we're going to have to lock back down, that the governor's going to say stay at home order is back in place, or can we utilize the things that we know? And maybe there's no answer to this, but I like your opinion. Can we utilize the things we know, the mask, the hand washing, the social distancing, the other things that we've learned to mitigate this enough to keep our society running at least some reasonable level?
Yes, I think that's entirely doable. I mean, obviously, in an extreme situation, we would have to go back to more restrictive measures. But the thing is these policies work because the population is making them work. The residents of Michigan have followed the recommendations, and they have been the ones that have resulted in these lower infections. And even as things start opening up, as we visit our restaurants, as we go and visit family that we haven't been able to see for several months, we still have these restrictions in place, these self behaviors, hopefully, that have been modified that will ease the risk, right? There's always a risk, and the question is managing that risk and whether or not you do multiple things that increase the risk or try and mitigate those as much as possible. But yes, you're right. I mean, this is not sustainable economically for us to be in a lockdown forever. So we do have to have some resemblance of normalcy, but that normalcy is going to be different than it was before.
Dwayne, this has been a pain, and no one is really happy with the governor because this has impacted all of us. I mean, we're going to talk to Paul Glanz in a couple of minutes, and he's opening his Imagine movie theater for a very good reason on Friday, but against the governor's wishes. So this has been hard every step of the way, and I think this thing I've said has been harder for her to untangle than it was to tangle it in the first place. That all said, you look at where we're at right now, and it's really hard to draw any other conclusion than the governor has saved lives.
I would agree, right? And there's historical precedents for this too, from the 1918 flu pandemic, where we've seen communities that acted early on saved lives in the long term, right? And the idea is to, as you've heard, flattening the curve. The idea is to try and reduce the number of infections so that our systems can handle the burden until there's interventions that are available for treatment and vaccine protection.
And in the interest of being fair and unbiased, because we don't take sides here, we're a community broadcaster, so we don't do that. But in the interest of being fair, we could also say that the governor's decisions with regard to putting COVID-19 patients back in nursing homes here in Michigan, that didn't work out so well.
That it didn't. And the thing is that there are decisions to be made. They're made with the information that's at hand. And as you had mentioned earlier, as we go through this process, we are learning things new all the time. We are learning how many people are truly infected. We are learning in terms of why some individuals are asymptomatic versus others that have severe infection. We are learning what therapies can work and which ones don't work. All of these things are changing the relative infectivity for a particular population. And as we've heard, our numbers have come down in terms of one individual infecting the next. So anything that can do to mitigate those are going to be helpful. And we do that, we learn that over time. So we are going to make mistakes, particularly when we're trying to rush to try and make plans to mitigate these situations. But, we learn as we go along.
Dwayne Baxa, Associate Professor, Oakland University Beaumont School of Medicine. Professor, I assume you're in the business of teaching young minds what's going on in the world. Are you going to create some COVID-19 curricula?
Actually, we have. We did a relatively short course. It was a 2-week course for our M3 and M4 students, where they did a self-directed activity creating resources actually for their peers in the medical school community, as well as residents and physicians, to provide resource information. So we did that as a course, and then the students were able to produce a product that then can be shared with other individuals, giving them information about how to manage, particularly from the students' viewpoint, because they are going to be in the hospital in their clerkships, as well as those that are graduating are going to be in their residencies, and they need to learn how to function within this new environment.
Well, and it's a traditional role of universities to take a look, educate kids, research, and provide information back to the community. Clearly, at Oakland University, you've been a big participant in that, along with our other major educational institutions here in Michigan.
Hmm. Yes, and we at Oakland University too have a sense of community serving our community. So a lot of our projects, um, particularly from the medical school side of things, are community based. We evaluate programs for individuals in terms of health disparities, access to care, things like that, medical literacy education. Our projects cover quite a distance of things. And I'm actually one of the co-directors of our Required Embark program, which is a scholarly concentration program. All of our medical students are required to do research over their 4 years of medical school training. And this program allows them the opportunity to not only understand the concepts of research, but also be good consumers of research information, because certainly not all research information is necessarily going to translate into clinical decision making right away. So they need to know when it is appropriate to apply that information and how to be critical of the information they do receive. Not only that, they need to be good communicators to the public and translate to their patients what these things see, because particularly in this era of internet news and so forth, people get information and they're not sure whether or not this is good information or bad information. And that is one of the jobs of our healthcare professionals, is to translate that information to our patients.
It's every citizen. I'm so glad you brought that up. In this society, it's every citizen's job to take what you see from the media, the internet, a post on Twitter, and just take all that stuff, and you gotta assess that as an intelligent American and process that against all the rest of the information. Unfortunately, we don't have Walter Cronkite around at the end of the day to put it all in a nice little 30-minute bundle for us. It's a different time. We have a lot more information, but with more information, you can get a little bit more garbage too. So people are
And
doing a
also
pretty good
because of
job.
the rush to get information, right?
Yeah.
We see in this situation with COVID, everybody wants to know what's going on, and then you see some individuals in the public sector that are frustrated because today we hear this, and tomorrow all of a sudden it's different. And the reason is because we're trying to get the information out there to be utilized quickly, but at the same time, as we learn something new, that may change things. So this is a very dynamic situation, and we need to keep that in mind as a population, as a community that's trying to work through this.
There's two sides to that. I mean, more information, and that can be good, but you just have to measure that information that you're getting. Uh, do, do young people want to be doctors now? Is all this and the danger that doctors have faced over the past couple of months, is that encouraging young people to get into the medical profession, or do you think it's got some people scratching their heads, saying, "Man,
I
maybe I
believe
want
it
to be a
is to some
lawyer"?
extent. Yeah, well, I mean that does happen too, right?
Yeah.
But I believe it does to some extent. I mean, our students are vetted in their admissions, and many of them have been motivated either through personal experiences or interest in the field to become physicians, and they're very interested, particularly at Oakland University, of becoming compassionate physicians. It's something that we very much focus on. So I think that is what motivates our students, and even though these are difficult times and concerning times for medical health professionals, I think it drives them probably even more so to try and help our community.
Dwayne Baxa, assistant producer, or assistant professor, rather, Oakland University, William Beaumont School of Medicine. Thank you very much for being with us today. We really appreciate it. Before we say so long, you're an infectious disease expert. You know a heck of a lot more than we do here. A vaccine. What do you see in your crystal ball with regard to a vaccine?
From what I understand from the literature that's out there, a vaccine is probable. This virus is capable of infecting us, and we generate a relatively strong immune response to it, and it seems relatively durable. So that's good news for vaccine development. And I believe that, from what I understand, there are several vaccines that are on the horizon. Of course, we have to get through the trials phases where we determine safety and efficacy, and sometimes those don't pan out when we get to the research end of things, but in development and so forth. And that's why, it takes a certain amount of time for us to develop a vaccine that we feel is safe and effective to release.
Well, what's been interesting in this cycle, in the interest of trying to accelerate that process, is there's been support to begin manufacturing, even if the vaccine doesn't play out, and then all of that manufactured product goes to by the wayside. But in an effort to get this in front of people as quickly as possible, the ramp up of the manufacturing can take so long. That is one way to shorten the curve. Let's start manufacturing, even if we don't know if we're going to ever be able to put this product out in the marketplace. And I assume that is what's going on.
That is something they are considering. And we even, there's some aspects of that to even the yearly flu vaccine, right? Because if people aren't utilizing the vaccine, aren't getting vaccinated, that there's a certain amount of production that's made, and then that goes to waste because people aren't utilizing it. So if people don't get vaccinated willingly, you also have a production problem where you have a lot of vaccine on hand, but then it goes to waste. So there are considerations with that, obviously economically in terms of research and development for the companies that produce these. So there are a lot of aspects that are complicated.
All right, Dwayne, thank you very much for being with us. I really appreciate it. Dwayne Baxa, Assistant Professor, Oakland University, William Beaumont School of Medicine, and knows an awful lot about infectious disease. We'll keep you in our Rolodex. We still have an old Rolodex. We'll keep you in there and probably check in with you again soon. Thank you.
Okay.
Thank you very
much.
Sounds
good. Thanks for the opportunity.
All right, very good to be with you.
Take care. Stay safe.